And as we mentioned earlier, first responders had actually restart Damar Hamlin's heart not once but twice, once on the field and once at the hospital. And there's a lot of talk this morning about something called commotio cordis. It's where a single blow can actually stop the human heart, and we're going to talk a little bit more about some of that stuff.
Yeah, we wanted to find out kind of what the signs of this are, and if someone around you is experiencing cardiac arrest, what you can do to help. Our Kara Jeffers is joining us live in studio with a local interventional cardiologist with more on the details here. Good morning, Kara.
Good morning, Marissa. Mark, I'm here with Dr. Orestis Pappas, and you said that you watched that hit last night, or Monday night on television. What were your thoughts when you watched that, as well as, like we mentioned, you've got that unique heart situation. Your view looking at that and how they responded, what do you think, in general, what would a patient's chances be at survival from this point?
I mean, watching that, it's devastating. We see this fairly often in the hospital, but to see a young athlete there, that is very devastating. What happened, we don't know exactly, but as a consensus from the medical community, the patient suffered a cardiac arrest. We know that by the fact that he required CPR and by the fact that he required to be defibrillated, those are usually the measures that we do. The fortunate part was that they acted immediately on the patient and he was defibrillated immediately on the scene, which brought his heart back to rhythm. More details we will learn whenever, obviously, the hospital will release his information furthermore. If I have to guess, most likely, currently, he's probably being on a cooling protocol where they intentionally sedate the patient and keep him on a ventilator and lower his temperature of his body in order to preserve brain function, because that is actually one of the sequelae of the cardiac arrest. Whenever these patients survive the initial event, is to preserve their brain function.
Yeah. For anyone, if you're out in the public, and what are some signs that people can see if someone has gone into cardiac arrest? What does that look like?
So usually it's an abrupt loss of consciousness, and sometimes we might see some jerking movements of the body, sort of like people having seizures, but that's not the case. They're not having seizure. It's actually cardiac arrest from loss of perfusion in the brain. The first thing that we need to do is to identify, make sure that these people are unconscious, and then start doing CPR. If there is a defibrillator right there, we attach the pads, and usually most of the defibrillators have self-instructions, and then we shock the patients back into rhythm, and obviously call ambulance. But the first thing we could do is hands-only CPR, and anybody can do that.
Of course. All right. Well, stay tuned with Erie News Now as we continue coverage on this story. Head to our website for tips on how to respond to someone if they are in cardiac arrest. Mark, Brissa, back to you.
Thank you, Kara, and we certainly thank the doctor for that input as well. It might serve as a motivator, I would think, for some folks to maybe get back in if they've taken CPR classes in the past, to get retrained on that, and if they haven't, maybe to get into some CPR training. It can certainly make all the difference, as we just learned.
And also great advice on what to do if you notice someone experiencing the symptoms that they are going into cardiac arrest.
Have to act right away for sure.